Thank you, Mr. Chairman. You know, earlier this week, and I want to thank the chairman for doing this, both the chairman and I held a teletown hall meeting where we discussed issues specifically to the veterans in my district. And during that time, we received a call from one of the veterans who spoke specifically about the assets that's held by the VHA. And many of my constituents in the northern part of the district use the VA hospital in St. Louis. However, for some of the metro area, it is still difficult to get to St. Louis. So I guess the question I have is for you, Dr. Crump, or Mr. Sullivan, whichever, is do you believe, and I think we've answered it before, but I'd like to expand on it, that the proposed legislation could lead to increased assets of VHA, like CBOX, in areas like high veterans populations such as the Metro East?
Well, I can't speak to whether or not the legislation itself will lead to that, but I can speak to the shifting demographics of veterans and the modernization of healthcare. I mean, it is very clear to us, as has been shared, that our inpatient care demand is going down like 4 to 10% a year, whereas our outpatient demand for care is going up like 10 to 20% per year. So that's why we've had to add more community-based outpatient clinics, and we will continue to provide more ambulatory care. The other thing is telehealth has given us the ability to utilize excess capacity in one part of the country to provide care in another part of the country. And so it is our definite intent to work through VA, improving efficiency, partnering with DOD, and realigning assets to where the veterans are to deliver more care using more outpatient services, fewer inpatient services, but also addressing the increased demand for some mental health services and use of ambulatory care and telehealth services.
Yeah, and that's what we really want. My other question here is basically to the VSOs. At any time, have you been discussing with the VA, if we go forward with this, what the communications will be with the veterans in the area where maybe there's a relocation, maybe there are all of these things that occur, that they would then have an open communication with the veterans to communicate on how their services and the way they receive their services might be changed? Have you had those conversations?
I would just say we have, I think, brought it up in terms of this stakeholder engagement and how they would communicate and having this really effective engagement early on in the local communities, that's important, but also with the service organization so we can help educate, that we can help explain, and that we can also get them, where they need to be to have their input considered. And look at the big picture. So I think we've mentioned it in our discussions as these draft bills have been considered.
So I can tell you from the American Legion's perspective, we also included that in our written testimony. There was a portion of the bill that talks about conducting public hearings at every location where there could possibly be a reduction in service or reduction in buildings. And we question the logic of having a public hearing if it's only a storage facility or if it's a gas station or if it's something that's no longer used. But we absolutely demand and require public hearings where health care is going to be affected, and I think that's going to be a critical component of this.
Mr. Bost, I think it's no secret that veterans in many local communities don't have any idea what the heck is going on at their local VA facility, even when they're regular users. I mean, I think one of our chief complaints that we hear about is there's no effective communication about major changes that are going on. And so now we're going to go down this road with a process where we're going to hope that VA is going to conduct public discussion and public interaction with those people in those local communities. It doesn't really happen effectively now. So it's a serious concern we have if we're going to go down this road.
We will make sure that happens, and we'll certainly participate in the process to ensure that for the VFW, our members are there represented. But the key is that the plan is what veterans want, right? Because often you can listen to them, you can have a hearing, but then VA goes a completely different route, and that's where you get the issue, right? We're membership-based organizations, and if my members VFW members in any particular area aren't happy, they're going to come to us and they're going to say, do what you can to stop it, and that's exactly what I'm charged to do. So,
Okay, my time has expired, and I yield back.
General Burke.